So our next speaker is Josefa Ros Velasco, and she'll present a paper titled Boredom as a Risk Factor for the Physical and Mental Health of the Elderly, an overview. Josefa is a postdoctoral researcher in the Department of Philosophy and Society at Complutense University of Madrid since September 2019. Previously, she was an assistant professor in the Department of Romance Languages and Literature at Harvard University. She is the author, editor of books such as Boredom is in Your Mind from Springer in 2019, The Culture of Boredom, Brill 2020, and The Faces of Depression in Literature, Peter Lang 2020. Currently she's the president of the ISBS. So please join me in welcoming Josefa. So thank you.
Thank you, John, and thank you everybody for your attendance. I'm starting thinking that it was not the best idea to schedule my presentation between Weidman van Tilburg and John Eastwood. It was not any strategy, but I was not sure about which would be the best place for my presentation. So after some years specializing myself in boredom studies, from the last year, I attempt to do research on boredom and aging. I would like to start telling you about how I became interested in this topic, okay? So 15 years ago, my grandma was about 88 when she began to require special care. Making the decision to change my grandma's life completely and place her in a nursing home was one of the hardest moments in my family's history. We visited her weekly, and I remember the widespread boredom within the walls of the nursing home. My mother denies this, but my grandma always complained of boredom. I know this because it was the reason why I decided to study boredom. She was one of the most involved in the activities of the center, but I remember her frustration when nurses tried to encourage her to do things that she described as for kids, not meaningful and boring, of course. In all these years, I have not been able to stop thinking the following. What if the staff had ever asked her what she wanted to do? I've always been convinced that the elderly have something to say about this, but they are rarely encouraged to speak out. So, how does boredom affect the elderly? Scholars have demonstrated that boredom is one of the biggest problems in old age, ranking number 7 in the top 10 of the most important setbacks, especially for those living in nursing homes. It has been considered a psychosocial disease, what that concerns 60% of dependent elders. This is not surprising if we know that being bored all the time causes physical and psychological problems in the elderly, including anger, irritation, frustration, agitation, nervousness, sleep disorders, disinterest, loneliness, depression, and even suicidal ideation. Certainly, boredom jeopardizes the goal of ensuring the physical and mental well-being of the elderly living institutionalized. At a glance at the literature, it's easy to see that those living institutionalized or alone are the most prone to boredom, as well as people living with dementia and reduced mobility. Boredom in the elderly is something that should concern all of us who are interested in the well-being of older adults and in ensuring that the aging process is successful and dignified. It's surprising as well as worrying to go to the literature to know about the state of the art concerning boredom and aging and realize that studies addressing boredom in the elderly are scattered in terms of dating, geographic scope, design, and subject, not to mention the scarcity of them. The lack of a conceptual map on the state of the art make it difficult to achieve an authentic understanding of the affair and to propose the proposal of interventions to prevent this risk factor in different care settings. Things being so, to meet my goal of making this problem visible and finding a solution for it, the first necessary step was to conduct a systematic literature review to explore what is exactly known so far about this complex phenomenon and provide an accurate state of the affairs from which to start building up. So on this occasion, I would like to share with you the results of a systematic literature review I conducted to better know what has been said on the couple, boredom, and on the elderly, and in which circumstances, including date, places, languages, type of studies, design, settings, and on the other hand, to provide a broad overview and to map major themes underpinning this phenomenon, and finally, to help to identify future research needs and gaps of knowledge. So, this systematic review entitled Well-being and Prevention of Boredom in the Elderly was conducted in 8 electronic databases up till August 2020, including languages such as English, Spanish, Italian, Portuguese, and French. The search strategy included keywords for boredom, aging, elderly, old people, old age, retiree, nursing home, geriatrics, and gerontology. The systematic review was reported according to the preferred reporting items for systematic reviews and meta-analysis guidelines, and the inclusion criteria were the following. The search was limited to the languages I just mentioned without time restriction. Due to the scarcity of literature only focused on boredom in the elderly, primary studies, reviews, discussion papers, books, and dissertations were included. And empirical and theoretical studies were included too, and studies had to focus on the theoretical or empirical analysis of boredom in the elderly, or at least address boredom in a significant way, among other themes perhaps, but playing boredom a key role for some part of the study. So the search strategy yielded almost 10,000 results, but after duplicate removal and full text assessment, 49 studies were included for review. 13 were totally focused on boredom and the elderly, and 36 were only partially focused on this couple. In sum, the profile of studies on boredom and the elderly correspond to qualitative scientific papers written in English and published during the last decade, mostly partially focused on the topic, paying special attention to the American paradigm of older adults, overall women over 75 years old, living equally at home and in nursing homes and suffering from boredom because of the sitting conditions. The identified key topics were 7. Boredom experience and boredom proneness, boredom, housing and institutionalization, boredom and retirement, boredom and mental diseases, boredom and mental disorders, boredom, loneliness and helplessness, boredom and reminiscence, and finally, boredom and leisure. And now I'm going to say a few words on each topic, okay? So starting from the beginning, the first thing was the general approach to the experience of boredom in older adults and how prone they are to boredom depending on demographic factors. Not every older adult is equally prone to boredom. For instance, elders who think of themselves too much were more prone to boredom, according to these studies. The elderly living in different houses on a rotating basis experience more boredom than those spending all the time in their own home. They are less bored when living as a couple or as a family, and also when they act as caregivers of grandchildren or other adults. Concerning gender, boredom in men has to do with leisure, and in women with a lack of care opportunities. One study suggested that women are more prone to boredom than men. And concerning age, people after 85 are especially prone to boredom. Surprisingly, some authors have claimed that elders are less prone to boredom than the rest of the people in general terms, because They say that the elderly have less need for cognitive stimulation. Sorry, for cognitive stimulations. So, but they are a minority. An standing theme is that of how boredom influences the daily lives of elders depending on the setting. Researchers have paid attention overall to nursing homes, but also hospital, rehabilitation centers, and retirement communities are mentioned. Researchers conclude that boredom is worse for those who live institutionalized in nursing homes. The reasons are the following. The first one is that in some cases, nursing homes don't offer interesting external stimuli, and the chances to engage in meaningful, pleasant, and challenging activities are rare. Other times, boredom is the result of the residents' reluctance to adhere to such activities. Lack of companionship and opportunity to care for others is another reason for the residents to get bored. And finally, monotonous routines and schedules have another part of responsibility. So, as a result, boredom has a negative impact on the residents' mental health and contributes to creating unsafe settings. To overcome boredom in residences, it's necessary to promote activities of the residents' choice and making nursing homes more homely environments. The next theme is boredom and retirement. The experience of boredom after retirement and its implications in terms of health was a topic of research from the 60s to the 80s, especially for men unable to manage their time after retirement. They were used to spend all the time working, and suddenly they have all the day to free activities, and they didn't know how to spend that time. The inability to deal with the boredom of having nothing to do or not knowing what to do was understood as the reason of a shortened life expectancy, depression, apathy, and even suicidal ideation and death. So, in the same line, several studies have focused on the relationship between boredom and one of the most common mental illnesses in older adults, which is dementia. 63% of the time, residents living with dementia were unoccupied, which clearly led to boredom. Boredom resulting from the lack of activities led to some upsetting delusions and confabulation in patients with dementia, as well as to hallucinations, agitation, and violence. Many works, on the other hand, mention in passing that boredom correlates with mental health, for example, with cognitive decline, psychological frailty, and stress and mental fatigue, for example. Two mental disorders and two behavioral disorders are at the fore concerning boredom in older adults. Depression and anxiety on the one hand, and gambling and suicidal behavior on the other. In all cases, boredom increases the problem or is directly its cause. A number of studies analyze boredom as one of the three plagues that affect residential life, together with loneliness and helplessness, following the philosophy of the Eden alternative movement, in which we cannot stop now, but I'm an Eden ambassador in Spain, and if you are interested in this field, I can tell you more later on Saturday. In sum, they show that boredom is the result of the lack of spontaneity and variety. Penultimate theme is boredom and reminiscence. There are many studies that have been carried out to show that the use of reminiscence through remembering bitter memories to alleviate boredom has negative consequences for the elderly, and professionals don't recommend to use this kind of therapy in these cases. Finally, Some studies emphasize the need to educate people so that they know how to manage their free time, making use of their own resources and those of the environment, just to learn how to avoid boredom. Basically, the studies try to test educational plans and activities developed in residencies to evaluate their viability. So, I'm going quickly. To conclude, I have to say that except from 3 studies, all works say that state boredom and boredom permanence are risky for the elderly. Many triggers for boredom in the elderly have been stated in the literature review. Boredom permanence is one of them, but also demographic factors and especially the environmental one. The setting is truly important to understand the experience of boredom. Residential life has been identified as one of the biggest reasons for getting bored. The root of the problem is in the lack of meaningful activities, the absence of variety and spontaneity, and the lack of companionship. This also applies to people living with dementia in different kinds of institutions. Most researchers agree that boredom has a negative impact on the elder's mental health, physical well-being, and contributes to creating unsafe settings. In sum, boredom adversely affects the quality of life of older adults. Many studies included in this review highlighted the need for investing in leisure education and leisure programs to fight against boredom inside and outside the residencies, pointing out that activities must be always of the elder's choice and that everybody surrounding the elder must be committed with them. For this to happen, it's necessary a move beyond a task-focused orientation model of care to a person-centered model where the elderly direct their own care needs and as leaders, as proposed by the Eden alternative philosophy. My systematic review showed that current scientific literature on boredom and aging is scarce and scattered and doesn't allow to comprehensively understand and address boredom in older adults. More empirical research needs to be conducted in different countries and settings to better understand the experience of boredom in the elderly, especially now that the aging of the population is a challenge in our future societies, you know. Okay, likewise, research needs to be focused on boredom specifically and not as a correlated phenomenon, as is the case right now. Very few studies focus totally on boredom and aging, and among them, the majority are all theoretical viewpoints published in the 70s, the 80s, and so on. And this is something that needs to be addressed in the coming years, so that we can work on boredom-focused prevention model to be applied and evaluated in different settings and institutions and situations, sorry. So I'm working right now on the design of a project devoted to studying boredom in Spanish nursing homes, because in Spain the situation is worrying. Only 4 papers focus on boredom and aging are by Spanish researchers. Only one of them is totally focused on boredom and aging, and not other correlated phenomenon or risks. And this one is a viewpoint published in the 70s. So we are not even working on prevention models. No, we are not even taking boredom as a risk factor, but taking it as a joke, in fact. So I want to develop a boredom prevention model, something like a system to facilitate communication between the inmates and the staff, just to make it possible for them to speak out their ideas, their desires. And by the way, I'm also looking for a good journal to publish this review. So thank you so very much. I will be happy to ask your questions if you have any now.
Thank you so much, Josefa, for a wonderful presentation. So we have some time for questions. Okay, let me just move my thing so I can see here. Okay, we have a hand up. Yes.
Okay. Yeah, I have a question because you did desk research on the subject, but are you willing to further this research area by your own research, like I know by interviews, by observations, further observations, and so on, to amend the situation in the research, but maybe also in the elderly homes?
Mhm. Yeah, this project I'm right now applying for for funding. Consists of 3 years. It's a 3 years project in which the first year just is focused just on conducting research, a study of basic research. Okay, just to know what is the self-perception of boredom among the elderly living institutionalized in Spanish nursing homes. This is the first step. So after that, I would love to be trained in the Eden alternative philosophy, because they are I think one of the movements that that want to address these 3 plays: boredom, helplessness, and loneliness. So I want to be trained in that philosophy, just to know, as a matter of inspiration, to later develop this prevention model. But always the Eden alternative is a global movement that doesn't pay attention to specific circumstances of each country. It's applied worldwide and even in European countries, not in Spain yet, but they are setting up the first headquarter. But what we need is to pay attention to the particularities of our society. And perhaps this prevention model can serve as an example and an inspiration for European neighbors. I hope so. I hope so. But this is a very big endeavor I'm working on right now. I took the first step, that was to conduct this systematic literature review, just to know, because I spent a lot of time reading about this topic, but I was unclear about what is exactly the state of the art. So this was the first step. I hope to be able to publish the review soon and to start working in the design of this study of basic research on the field work.
Mm-hmm.
And of course, I would love to invite anybody interested in this project to join me. How knows?
So I keep my finger crossed about your grant. Yeah.
Thank you so much.
It's worth it. Sure.
Thank you.
Thank you very much.
Yes, so Josefa, there's a number of comments just reflecting how important this work is, and people really see the meaning and value in this project. And so wanted to raise that. Vinehand has a question.
Yeah, thank you so much for your talk. I think you're spot on that this is an area that hasn't been seriously addressed yet, and seems to be really important. But I'm just curious. So we did some work on nostalgia and boredom in the past, and we found that boredom causes people to become more nostalgic. But we also found that in turn, I haven't presented that today, but nostalgia also makes people's lives in turn seem more meaningful. And I've always wondered if this is something that is particularly helpful, especially for people who might be in for example, the elderly or so, where mobility and engagement outsiders may be limited, but nostalgia is something they presumably have a treasure of nostalgic memories that they could bring to their own age. So I was just curious what you think of that.
Yeah, it's perhaps it's not very intuitive to think that that spending time just remembering your memories is gonna be a bad idea. But the fact is that if nostalgia is goes together with that painful state, that painful emotion, that at least 7 studies in my review say it's not good for the elderly, just because they use this process just to avoid boredom, just because they have nothing to do and just spend leaving their minds fly free to the past. But there is no problem. There is no problem in doing this if you are remembering remember good times. Okay, but in case you are going back to your bitter memories to avoid boredom, then the stress increases. The stress, depression in the elderly is also important in this regard. And I don't know, I'm not sure, but almost all the studies in this field agree in this point. I have no idea. I don't think of this too much.
Okay, I think we have time for another question. Go ahead, Todd.
Hi, very interesting work, and tied into the previous question. Hey, curious about the plasticity of something like Alzheimer's, in which nostalgia then becomes less of a factor because there is the plasticity of identity, and so and using my father as a reference, seeing how he kind of created new identities. And also, you know, in the previous speaker, you know, attaching meaning and how meaning changes for you, and looking at how dementia and illness works in the research you're doing. I'm just curious about how something like that would affect your own personal research.
Okay. Yes, as I said, I'm not a psychologist. This is the reason why I say I'm not sure if my presentation fits this panel exactly. But since I was talking of health, after all, so I made that decision for better or worse. I don't work. I'm not a doctor neither, so I don't work with people living with dementia. In fact, thinking of this study, this project I mentioned, I'm not planning to work with people living with dementia, because I think you need to be trained in this disease, in this mental illness, in order to say a word. Okay, in order to say a word. So, but only 5 studies focus on boredom, and all of them are by the same author, by the way. Are focused on the study of boredom in people living with dementia, and they warn that we need to pay attention to this, just because the behavior of people living with dementia, when they spend all the time doing nothing, just sitting usually in their wheelchairs, not to prevent movements and violence episodes and so on, they get bored all the time, and this leads to hallucinations. And these hallucinations sometimes are for good, but sometimes not. Sometimes they self-harm. Yeah, I think this is the word. Sometimes they self-harm themselves as a result of this boredom. And this all are empirical studies, so I trust in what which they say. But this is all I can say by now. Perhaps in the future, 20 years, in 20 years, I am specialized enough in this topic as to be able to work with people living with dementia and with specialists in this topic. But for now, I prefer just focus on the elderly who who are not cognitive impaired. Mobility reduction, okay, but not nothing to do with mental diseases.
Okay, well, thank you so much. So I think we've come to the end of our time for this panel. And I believe that we have a 10-minute break now, and we'll return again shortly. So see you all soon.